Hi, my name is Jessie. I'm the lead speech therapist and owner at Rogers Bridge Pediatric Therapy. Today we are talking about when will my child start talking? As an early intervention speech language pathologist, I am typically one of the first people to evaluate and treat a child. Sometimes these patients have been referred by their pediatricians, and sometimes the parents have referred them. One of the most common questions we hear is, when will my child start talking? Or how long until my child talks? This is a very tough question to answer because there are many possibilities to consider, including and beyond possible diagnoses. When a parent asks us to predict when their child will start talking, we show them the communication pyramid. The communication pyramid shows what skills must be gained prior to expressive communication and how those skills build upon each other. If a child does not have the necessary foundational skills for expressive communication, those areas of deficit must be targeted first. There are 7 different levels to the communication pyramid. The foundational is preverbal interaction and early interaction skills. Preverbal interaction is how a child communicates without using words. This includes eye gaze, vocalizations, gestures, and pointing. Early interaction skills refer to joint attention, turn-taking, and cause and effect. The second level on the communication pyramid is attention and listening. Attention and listening refers to learning skills like waiting, listening, anticipation, and attention to task. But it also includes hearing and paying attention to what is going around them. We look to see whether a child is paying attention to what others around him are doing, or if they have noticed an interesting toy in their area. A child is more likely to connect a spoken word to an object if they have first analyzed that object. Waiting and anticipation can be shown when a child becomes familiar with routines and activities. These skills usually come into play when a child is familiar with the routine and anticipates what's going to come next. For example, after I wake up, I get my diaper changed. This may mean that the child lays down and is compliant during a diaper change, or that they go grab a diaper and hand it to you. When attention and listening skills are achieved, a child should be able to complete a short task like completing a puzzle. The next level on the communication pyramid is play. There are many different types of play that gradually become more complicated. When working with young children, we eventually work up to play that includes turn-taking and social interaction. To have a good foundation, a child must first have functional and relational play skills. Functional play is when a child uses items as they are meant to be used. For example, you turn pages of a book, you stack blocks on top of each other, you kick a ball. Relational play involves using objects towards themselves and can include simple pretend play activities. So the child may pretend to eat something or pretend to fall asleep. The next level on the communication pyramid is understanding. Understanding can also be explained as a child's receptive language skills. This entails following directions, understanding questions, identifying familiar objects, and understanding spoken words. A child is unlikely to produce a word if they do not first know what that word means. The next level on the communication pyramid is talking. Expressive language, or talking, is a child's ability to make their wants and needs known. To be able to accurately communicate with others, the child needs a good vocabulary. A good vocabulary includes a variety of words like pronouns, adjectives, prepositions, verbs. When a child has a variety of words, they will be easily able to move from one-word utterances to more complex utterances. Having a good vocabulary and using grammatically correct sentences is imperative for a child to communicate their wants, needs, thoughts, and ideas accurately. The next level on the communication pyramid is pragmatics. Pragmatics refers to a variety of skills that are used during social interactions. Depending on the age of the child, pragmatic language may refer to collaborative play or to more complex understanding of social interactions. More complex social language includes idioms, body language, and taking the other person's perspective. The next and highest level on the communication pyramid is speech sounds. Speech sounds refers to a child's articulation skills or the ability to produce sounds correctly. As your child develops, it is expected that their sound repertoire will develop as well. A 2-year-old is not expected to produce the same sounds as an 8-year-old. If you are concerned with your child's language or articulation skills, give us a call. We offer free phone consultations and will help you determine if a language or articulation evaluation is appropriate for your child.